Polypill. Never has a drug caused such controversy in the scientific and medical communities. Tonight we explore the issues surrounding a new line treatment in cardiovascular disease. If your blood pressure wasn't high before, it certainly will be tonight. Welcome to Catabolism, where we break down the latest issues in the medical world. I'm Sandra Roberts. Cardiovascular disease affects 1 in 6 Australians. Globally, it is the number one killer with an estimated 17.3 million deaths worldwide. In fact, one person dies every 12 minutes from cardiovascular events. The major risk factors involve high blood pressure, high cholesterol, obesity, smoking, drinking alcohol, and a sedentary lifestyle. Currently, the medical treatment involves numerous pills to target high blood pressure and cholesterol. The Polypill is currently being developed as a preventative treatment that aims to improve medication adherence at a lower cost. The idea is to take a daily pill containing a fixed-dose combination of medicines that can halve risk of cardiovascular disease. These medications generally include a blood thinner, a cholesterol-lowering drug, and 2 or more antihypertensive drugs. A number of polypills have been trialled, and different combinations usually only differ in the antihypertensive components. The trademarked Polypill contains aspirin, folic acid, an angiotensin receptor blocker, a calcium channel blocker, a thiazide diuretic, and simvastatin. Statins, such as simvastatin, inhibit the synthesis of hepatic cholesterol by acting as a reversible competitive enzyme inhibitor of HMG-CoA reductase. HMG-CoA reductase catalyzes the conversion of HMG-CoA to mevalonic acid. Angiotensin-converting enzyme, or ACE inhibitors, such as lisinopril, competitively inhibit angiotensin-converting enzyme in the renin-angiotensin system. ACE converts angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor, antinatriuretic peptide causing salt retention, and a stimulator of aldosterone release from the adrenal glands. Angiotensin 2 receptor blockers, such as losartan, competitively block the action of angiotensin 2 at the angiotensin AT1 receptor. Thiazide diuretics, such as hydrochlorothiazide, inhibit the sodium chloride transporter in the distal tubule, causing an initial fall in blood pressure due to diuresis. The mechanisms of beta blockers, such as atenolol, is not completely understood. However, they are thought to involve a reduction in cardiac output, inhibition of renin release, and central actions to reduce sympathetic activity. Calcium channel blockers, such as amlodipine, block L-type voltage-gated calcium channels, causing relaxation of the arteries, leading to a reduction of peripheral resistance and reducing cardiac output. Thromboxane A2 triggers reactions that lead to platelet activation and aggregation. Aspirin is an antiplatelet agent that inhibits cyclooxygenase, a key enzyme in thromboxane A2 generation. Tonight, on the panel, we've got Dr. Anne Ling and soccer mum Lydia King.
Anyone with an ounce of sense, like yourself, Dr. Ling, will know that combining a statin drug, ACE inhibitor, and an aspirin is surely a recipe for disaster.
Actually, Lydia, there are many positive reasons why we combine 3 drugs. Studies have shown that patient adherence is much higher taking the Polypill opposed to taking separate pills. Polypill has been shown to lower systolic blood pressure and cholesterol levels much better than the usual care. Not to mention, Lydia, the cost it will save many patients.
Yes, Dr. Ling, and the problem with the Polypill is side effects, and that's times 3. When combined, statins can cause liver and kidney damage, ACE inhibitors can cause cough and dizziness, aspirin, stomach and intestinal bleeding. I've done my research, and 1 out of 6 people showed side effects.
Side effects are part of life. Eating cheeseburgers and not exercising properly certainly has its side effect, doesn't it, Lydia? Secondly, patients need to take most of these components of the pill anyway. Bottom line is, if it lowers your risk of heart disease and stroke, then I say take the pill, take it now, and take it every day.
My next problem with the Polypill is that some patients might be receiving components of the drug that they don't actually need, not to mention issues involving change of dose. For example, how would you increase treatment if a patient is on a fixed dose concentration?
And that's all we've got time for tonight.
Actually, if I could add one more thing.
Whew, what a heated debate. And that's my blood pressure. And that's all we've got time for tonight. This is Catabolism, and I'm Sandra Roberts. Good night.
Oh,